Good morning, everyone. Thank you for coming. I suspect everyone know who I am, but for those who may not, my name is Dr. Albert Reese. I'm the Executive Vice President of the University of Maryland, Baltimore, and Dean of the School of Medicine. So I'm delighted that each of you has joined us today. Today marks really a historic moment for the University of Maryland School of Medicine, and I'm just delighted to share this occasion with you, and I'm quite proud of the reason for which we're gathered. But before I continue my remarks, I'd just like to recognize a few folks, distinguished friends and leaders who are here. We're privileged to have with us our U.S. Senator Chris Van Hollen, who has been a long-term supporter of the University and the School of Medicine, and he has been a leader in the area of biomedical breakthroughs that really, you'll hear momentarily, its impact has been immeasurable. So, Senator, thank you very much for coming. Also delighted to recognize our board chair, Mr. Michael Cryer, sitting in the front. Many of you know Mr. Cryer has been a wonderful leader of the School of Medicine board for many years, has been a real supporter, a tireless advocate for what we do. So we're just delighted that he has been able to make time out of his busy schedule to be with us. We have senior leadership of our Center for Vaccine Development, our School of Medicine, who are here throughout the audience, and we're delighted that you're here as well. We have a tradition here in the School of Medicine of innovation, discovery, and leadership. Our faculty every day works tirelessly and has been successful in saving hundreds of thousands of lives with scientific breakthroughs on the most challenging diseases and conditions. Some of these diseases include HIV, cancer, heart disease, and stroke. When you think of it for a moment, the number one cause of death in America is heart disease. So we tackled that. The number two cause of death is cancer. We tackled that as well. Number three cause of death, stroke, and hypertension, and we tackled that as well. What lies at the core of our mission at the University of Maryland School of Medicine is to take on diseases and conditions that have the most devastating impact on human lives. Those include high morbidity, high mortality, and high disability. One of our many aims is to bring new technology and treatments out of the research laboratory into our clinical practices and really to patient care, with our ultimate goal, and that is to improve the human health. We're here today to announce something very special and one that impacts directly the points I just made. We have an important announcement about our Center for Vaccine Development and Global Health that we refer to as CVD. For decades, this Center for Vaccine Development, which initially was launched by Professor Mike Levine, sitting right here, 45 years ago, sounds right? About that. That really has had a worldwide impact. For decades, the center has researched, tested, and developed critical vaccines and therapies for diseases that impact the world's most vulnerable populations. CVD has worked domestically and internationally to develop, test, and deploy vaccines to protect and prevent, again, some of the most devastating and complex diseases. Just to name a few: influenza, cholera, typhoid fever, and malaria. CVD has taken on global leadership roles in more recent years, promoting vaccines to protect against emerging pathogens such as H1N1, Zika, and even Ebola virus. Today, we will be announcing another landmark research initiative that will ultimately impact millions of lives. I wish to extend, on behalf of the School of Medicine, our congratulations to all who have been involved in this important milestone, which you'll be hearing about momentarily. So with that, I'd like to invite to the podium Dr. Kathleen Nuzzel, the Professor and Director of the Center for Vaccine Development and Global Health. Dr. Nuzzel will be making the formal announcement at this time. Dr. Nuzzel.
So thank you, Dean Reese, and good morning, everyone. We appreciate you being here to help us celebrate and kick off an important new research program at the School of Medicine. But before I get to that announcement, I want to take the opportunity to remind everybody about influenza. So influenza or flu, we know, is a contagious respiratory disease. It causes outbreaks every year, and it affects all age groups. If you look at numbers, there are millions of flu episodes in the US every year, hundreds of thousands of hospitalizations. It fills up our hospital every year, and tens of thousands of deaths. It costs our country about $50 billion a year. We know that influenza vaccination is the best approach to preventing influenza. And we know that everyone 6 months of age and older should get the vaccine. So that is everyone in this room. This is also the perfect time of year, September and October. So please get your influenza vaccine to protect yourself and to protect those around you. We also know that influenza vaccines aren't perfect, and our government is committed to a goal of developing better, more broadly protective, and longer-lasting influenza vaccines. The NIH is funding a new large program, the Collaborative Influenza Vaccine Innovation Centers, or CIVICs, as part of that effort. And the overall goal is to develop new and advanced influenza vaccines. So I am thrilled to announce that we at CVD have received a large NIH contract to establish a civic clinical center. We've been awarded over $2.5 million for fiscal year 19 and a contract that provides a budget up to $200 million over the next 7 years. So what exactly will we be doing? As you heard from Dean Reese, the CVD under Dr. Levine's leadership has for decades been a leader in testing and innovation development of new vaccines of all types. So we will be testing new and innovative influenza vaccines in clinical trials. We'll be performing laboratory tests, understanding the immunology of flu and flu vaccines. In addition, we'll be performing studies called Controlled Human Infection Studies or challenge studies. And the CVD has been a leader in developing challenge study models as well. And Dean Reese, you mentioned a few of the pathogens, malaria, cholera, typhoid. So what we will do is we will intentionally give influenza virus to healthy volunteers under very controlled and closely monitored conditions so that we can understand exactly how people get infected with flu, how their body responds to infection, and importantly, we can use this model to test new influenza vaccines. So rather than involving thousands of people over many years, this is a much faster and less expensive way to understand how these novel vaccines might work to prevent influenza. Now, people have also asked us how this effort is different than other efforts to develop better flu vaccines. We've heard a lot about better flu vaccines or universal flu vaccines for many years. Well, this is a different model on a larger scale than anything that has ever been done before in this field. It's bringing together the best influenza researchers and experts in the country to work together with NIH on this very ambitious goal. So we have talent, we have time, we have resources, we have leadership, and we have a collaborative environment. So thank you very much.
This is a very big deal for the country and for Maryland and for Baltimore and, of course, for the School of Medicine. And Dr. Reese, Dean Reese, thank you for your leadership here at the school. It's also great to see my friend and the chair of the School of Medicine, Michael Cryer. Thank you and the board members. And we are very proud, Senator Cardin and I and others, to represent the state of Maryland, but we're really proud to represent the University of Maryland and the School of Medicine. And as you well know here, but I think it's important for the world to know, that the faculty here ranks among the top 10 nationally for public medical schools in research productivity. And that's why when the NIH is looking for the right place in the country to make this kind of investment, they look here, and they look here because of the incredible team of researchers. Dr. Nuzul, congratulations on the extraordinary work you've done to date in all sorts of areas, and the proposal that you put together, which obviously caught the eye of the NIH. Dr. Chen and Dr. Campbell, thank you for your efforts being part of the team. And Dr. Levine, thank you and the whole group here for your long devotion to these important efforts. The development of a better flu vaccine and ultimately a universal flu vaccine is important and life-saving work. And I think the American people have gained a greater sense of the severity of the impacts of the flu vaccine in some of recent flu seasons, which have been particularly tough. According to the Centers for Disease Control, the CDC, the death toll for flu-related diseases in the last flu season, the 2017-2018 flu season, was 79,000 Americans dying from flu-related illnesses. And as Dr. Nuzul mentioned, in addition to that terrible human toll, there's also a huge economic burden placed on the country because of flu. According to the CDC, it costs the United States $10.4 billion a year in direct medical expenses, and more than $87 billion every year in total economic loss, every year. So we need to tackle this issue with urgency. That's why I'm really pleased that the National Institutes of Allergy and Infectious Diseases at NIH have placed a very high priority on this. Dr. Fauci, who's the head of that center, comes to Capitol Hill often, and for years we've been talking about a major national effort to get this done, given the cost in terms of lives as well as the impact on the economy. And that's why, after years, Senator Markey and I and some others introduced earlier this year the bill that Dr. Reese referred to, the Flu Vaccine Act. And that act would authorize $200 million per year for 5 years focused on flu vaccines and developing a universal vaccine. So we're going to keep pushing to move in that direction. But I can say that on the Appropriations Committee in the Senate and the House Appropriations Committee, we've been moving toward that goal. In fiscal year 2019, which is the year we're in right now, the Congress appropriated $140 million toward the flu vaccine effort. And in the Senate appropriations bill for the coming fiscal year, which still has not become finalized, the whole bill, but we have $165 million devoted for this effort. So a $25 million increase from last year to this coming fiscal year if we are able to finalize this. And I'm very pleased that University of Maryland School of Medicine was selected among very few centers in the country to be at the forefront of this effort. And as Dr. Nuzzo mentioned, it's $2.5 million this year, and with the provisions that can take it to $200 million over a period of 7 years. That's obviously a big investment by the American people, by NIH, and it's a testament to the confidence that NIH has in the good work being done here at the School of Medicine. So it's wonderful to be with all of you. Let me just say one closing word about the importance of NIH research generally. And it is wonderful to have NIH in Maryland as well. We have got to increase our national investment in finding more treatments and cures to diseases that impact every American family and, of course, families around the world. The work we do here saves lives in America, but it also saves lives around the world. And if you talk to Dr. Collins, who's the head of NIH, he will tell you that we are still not meeting our overall financial goals. There's still lots of research proposals that come into NIH that are rejected not because they lack merit, but because of a lack of resources. And we also need to signal to all the young scientists out there that the United States values their work and that we will have funds there for research. It's been a great engine of discovery for the country. It's also been a great economic engine for us around the world. We have, in the last few years, made some very significant increases in the NIH budget. And it's been a bipartisan commitment. In fiscal year 2017, the NIH budget was $34 billion. We have taken that into the current fiscal year. Over time, it's now $39 billion. And again, if you look at the Senate appropriations proposal, and I'm proud to serve on that committee, we are proposing a $3 billion increase relative to last year, which would take the budget to $42 billion for NIH. So we've got to make this investment. Senator Cardin and I are partners in this effort. The whole Maryland delegation works very hard to support this because it's the right thing to do for the American people. And I'm just so proud to be here and recognize the incredible work of the University of Maryland School of Medicine and the fact that that is recognized nationally. We're very proud of you. Congratulations.
So thank you, Senator Van Hollen. Thank you for being here. Thank you for your kind words, and mostly thank you for all your support and your understanding of the need for research and the need to battle these diseases, because you're a unique politician and Senator Cardin to fight for us in this way. So thank you very much. We are going to take some questions. I would first like to say that, as with most of these large efforts, this was a team effort. We have been working on this for well over a year, and really it's everybody in the CVD and beyond who contributed to this in some way. There are a few of us standing up here, but this was really an effort by everyone. You know, Dean Reese, you've given us tremendous support from the School of Medicine level. And of course, we couldn't do it without the legacy of Mike Levine and the reputation and the work that he established at CVD. I'm going to introduce just a few people so you will know who's in the audience here that I can help direct your questions to them. So sitting up in front with me is Dr. James Campbell. He's a professor of pediatrics. He is an investigator on this effort, and he leads our pediatric vaccine trials. Next to him is Dr. Wilbur Chen, who's an associate professor in medicine, also a co-investigator on this effort, and he leads our adult vaccine trials and human challenge studies. And here in the front row, we have Drs. Marcello Stein and Marcella Passetti. Both are professors in pediatrics, both are world experts in immunology and co-investigators on this effort. And I don't think I've missed other co-investigators in the room, but raise your hand if I'm not seeing you. We will all be available afterwards to talk to you individually. And the other aspect perhaps I can emphasize is we consider certainly the overall research and goal to be a benefit. But this also gives the people of Maryland, and specifically the people of Baltimore, access to some of the newest vaccines. So for anybody that's interested in volunteering to contribute to research, we're always looking for volunteers. So thank you.
All right.